لا تنسوا الاعجاب بالفيديو والاشتراك في القناة.
Diabetes is known as the silent killer. The silent killer. The first few years you have diabetes, you may not have any definitive signs or symptoms. You definitely are going to have some subtle, vague signs and symptoms, but doctors often miss these. Nerve cells, your axons, they just don't function as well in a high sugar environment. The retina, the cornea, the lens of your eye just doesn't function as well in a high sugar environment. There are several reasons that your doctor might miss the diagnosis of diabetes in you. A lot of doctors are mistaken in the belief that if they check your fasting blood sugar and it's normal, then it's impossible for you to have prediabetes or diabetes. And this is going to give your doctor an indication of how hard your pancreas has been having to work and secrete insulin in order to keep your blood sugar within normal limits. Please don't ignore these symptoms or put off going to the doctor. Sooner it's diagnosed and treated, the less damage is going to be done. If you have diabetes that's undiagnosed, you run the risk as years go by of developing heart failure, kidney failure, liver failure, heart attack, stroke, having toes or legs chopped off, going blind. It's really, really bad news. Now let's get into these 7 early signs of diabetes that doctors miss. Diabetes is known as the silent killer for a very good reason. Namely, the first few years you have diabetes, you may not have any definitive signs or symptoms, and indeed your doctor may not check the proper lab work in order to diagnose you. And so the damage can be done over several years' time between when you develop diabetes and when you are actually diagnosed with diabetes. During this time, you definitely are going to have some subtle, vague signs and symptoms, but doctors often miss these, and you might miss them also. I'm Dr. Ken Berry, a family physician with 20 years of clinical experience. And this video is going to tell you 7 early signs of diabetes that doctors often miss. I have many videos on this channel about diabetes, about metabolic syndrome, and about insulin resistance. If you think you have diabetes or think you might be developing it, all these videos will help you if you'll watch them. Now let's get into these 7 early signs of diabetes that doctors miss. Number 1 is frequent urination. And so compared to how frequently you used to urinate, you're now urinating many more times a day than you used to. This is a direct result of having high blood sugar. Usually, when your blood sugar gets above 180, you'll start to spill some sugar out into your urine, and the water tries to follow this sugar, and you can wind up losing a lot of water this way. And it goes hand in hand with symptom number 2 of early diabetes, which is severe frequent thirst. And so since you're urinating so much more often, you're going to have to replace those fluids. And so you'll find yourself ravenously thirsty for no real reason. You haven't worked out, you've been drinking liquids all day, but you're still super thirsty. That could be a sign of early diabetes. Number 3 is constant hunger. This is very common, and sometimes this hunger can ramp up very gradually, and so you don't really recognize, man, I'm eating a whole lot more now than I used to eat. But if you'll think back, you'll realize, you know, I'm hungry all the time now. Even if I've just eaten, I'm still hungry. That can be a sign of early diabetes. Early sign number 4 is extreme fatigue or weakness. When your blood sugar's high, it's high because the glucose can actually get into your cells to provide energy, and that can make all of your muscle cells and other cells weak or fatigued. And then also your nerve cells, your axons, they just don't function as well in a high sugar environment. And so this combination of things can lead to you experiencing extreme fatigue, extreme weakness. Even though you slept well last night, you haven't worked out, you haven't done anything strenuous, you're still just exhausted. Early diabetes warning sign number 5 is blurred vision. The retina, the cornea, the lens of your eye just doesn't function as well in a high sugar environment. And many people, as they're developing diabetes slowly over several years, will notice that their vision is getting rapidly worse in respect of being more blurry than it used to be. Now, sometimes this blurriness is associated with just getting older. But if you notice that your vision has taken a distinct turn for the blurry worst, that could be an early sign of diabetes. Early warning sign number 6 is slow wound healing, slow bruise healing, and slow bite healing. So it's very common. I've seen it in the clinic many times. Someone come in and say, I got these mosquito bites or this tick bite, and it hasn't healed, and it's been a month and a half. What's going on here? That could be an early warning sign of diabetes. If you have just a minor cut or a small bruise that just takes weeks and weeks and weeks to heal, when used to you could heal that in just a few days, that could be an early warning sign of diabetes. Early diabetes warning sign number 7 is tingling or pain or numbness in the hands and feet. Remember I said earlier that your nerve cells, your axons, just don't function properly in a high sugar environment. And so when your blood sugar's high all the time, but you yet haven't been diagnosed with diabetes, your neurons, which they have appendages called axons that the nerve impulses travel on, they don't work well. And so you wind up with numbness or tingling or pain in your hands and feet for no reason. The reason this starts in the hands and feet is because they're the furthest from your body. The axons to those nerve endings are the longest, and so you start to have trouble with those first. There are several reasons that your doctor might miss the diagnosis of diabetes in you. Probably the most common cause is you just haven't been to the doctor. Secondly, a lot of doctors are mistaken in the belief that if they check your fasting blood sugar and it's normal, then it's impossible for you to have prediabetes or diabetes, and that's absolutely false. You can have quite severe diabetes and have a normal fasting blood sugar. So when you do go to your doctor for one or more of these symptoms of early diabetes that I talked about, make sure and ask your doctor to check a fasting blood sugar for sure, but also to check a urinalysis to see if you're spilling glucose into your urine. Also ask for a hemoglobin A1C, which will give your doctor a 3-month look at what your blood sugar's been doing. And then finally ask your doctor to order a C-peptide test. And this is going to give your doctor an indication of how hard your pancreas has been having to work and secrete insulin in order to keep your blood sugar within normal limits. Please don't ignore these symptoms or put off going to the doctor. One of the key things you need to understand about diabetes is that the sooner it's diagnosed and treated, number one, with diet, but number two, maybe with medication, the less damage is going to be done. If you have diabetes that's undiagnosed, you run the risk as years go by of developing heart failure, kidney failure, liver failure, heart attack, stroke, having toes or legs chopped off, going blind. It's really, really bad news. So this is not one of those times when not knowing is okay. You really need to know if you are a diabetic or pre-diabetic. So please, if you have even one of the signs and symptoms I talked about in this video, go see your doctor ASAP and have those tests ordered that I told you about. Then, if your worst fears are come to light that, yeah, you're pre-diabetic or you're diabetic, then I want you to check out my Keto 101 playlist or my Carnivore Diet 101 playlist. I'll have them pop up at the end of this video. If you're diagnosed with type 2 diabetes, you can completely reverse that and get rid of it with a ketogenic diet or a carnivore diet. If you're diagnosed with type 1 diabetes or late onset adult autoimmune diabetes, you can lower your need for insulin injections by 70 to 90%, save a ton of money on insulin, and also protect yourself from the disastrous complications of uncontrolled diabetes. If you learned something from this video, please consider clicking that subscribe button and the little bell button right beside it so that you'll get to enjoy weekly videos. I usually post 2 or 3 a week here, and you might learn something else. This is Dr. Barry. I'll see you next time.
إن أعجبك الفيديو لا تنسى الإعجاب والاشتراك في القناة.